we're going to do for you. We have the very lovely Dr. Karan Wade in the house, and she is one of Houston's outstanding dentists and dental practitioners, whatever you want to call her. And she's here to supply you with information and to entertain as well as inform. Hey, Dr. Wade, how you doing?
Hello, Michael. I'm so happy to see you.
Well, hey,
you didn't get drowned in that water, did you?
Oh, heck no. Sugar floats.
Well, I couldn't make it here last week, so I'm here for my makeup day.
Okay, well, yeah, I was expecting Mrs. Provost to be in today, but
you stuck with me today.
Oh, well, hey, that's okay.
I hope that's
with
not
me.
a problem.
Oh, no, it is excellent. Good to see you, and of course, I always love those T-shirts. Changing the world one smile at a time.
Yeah, and then it says
number one dentist.
Number
one dentist. Now, where is that number one dentist located?
The number one dentist is located at 2101 Crawford. We're right on the corner of Crawford and Webster, Crawford and Gray, right across the street from St. John's Church. And you can reach us at 713-654-7756. Again, that number is 713-654-7756. We have a special running for all your listeners, Michael. You can come in for an examination, x-rays, and cleaning for $99. And we also do free consults. So if you're interested in any partials and dentures, implants, veneers, any of that stuff, you just give our office a call, and we'll set you up and let you come in for a free consult.
Right on. And what do they have to do? Just give a call?
They just need to call the office and say, I want to make an appointment to come in for a consult, and just let the staff know that you're coming in for a consult, and then there will not be a charge. So, So if anyone has any questions about partials, dentures, implants, veneers, they can call the station, and I'm going to let you give them the number because I'll probably give the wrong number.
All right. Well, the number here is 713-526-1230. 713-526-1230. And now, some of you know that today is my birthday, and the best present that you can give me besides money is by calling in and talking to Dr. Wade. Because what you don't get yourself, you like to give to others. And we want to show her some love on this day since she was making up her program from last week. Hopefully you didn't get too flooded out.
I didn't get flooded. I just couldn't get down the street. I have a little low car, so I didn't want to flood my car out, so I just kind of stayed put where I was.
Now I know you have a fleet. But in that
fleet of what?
A fleet of automobiles.
No, I have one car, just one automobile that belongs to me that I pay for every month. Pay a car note on it every month, so I don't have that fleet.
Okay.
In my next life, maybe.
All right. Well, I have to flee. So when we talk about fleet, just take the T off, and that's what I'm doing, running from.
You're going to flee.
Yeah, running from the people trying to take it back.
So what are you going to do for your birthday, Michael?
Well, one thing I'm doing is talking to you.
Talking to me. Well, outside of talking to you, are you doing anything exciting, anything fun today?
Well, I have a doctor's appointment.
Well, you know something? We need you to come down to the office so you can get your free bleaching for your birthday. You don't have to come today, but you can come whatever day is convenient for you, and I'll honor that. That'll be your birthday present from me to you.
Well, you know what?
Free bleaching.
I will let you do that because these 63-year-old teeth haven't been bleached since you bleached them the last time. Well, the teeth are not 63. They probably came in when I was about. What time do teeth come in?
Well, your baby teeth start coming in. They can come in as early as 3 to 4 months, but your adult teeth start coming in when you're probably about 6 years old.
Now, do you lose them all?
Do you lose all of your baby teeth?
Yes, do you lose them all?
You lose all your baby teeth, yeah. You only have 20 baby teeth, and those are little small teeth, and you do lose those.
I don't remember losing them.
Well, I believe you. You might not remember. It was like 63 years ago. Or 60, or 50-something, yeah. I don't know. But you did indeed lose your baby teeth, and you have some of your permanent teeth now. You have them all. I remember you coming to my office, and I remember taking x-rays, and you didn't have any baby teeth in your mouth. I would have told you, and I would have remembered.
Well, I remember losing the ones up front, but the ones on the side, I don't remember.
You lost them.
Oh, okay.
They're gone. You have all your permanent teeth.
All right. Well,
I can attest to that as your dentist.
Does Al Freeman have all of his?
He hasn't been in my chair. I don't know what his problem is.
I need the Denzel smile.
Oh,
well, I only can create Denzel smiles if we come to the office. And I can do that. You know that, right? Okay, I have those capabilities.
But you know, we sell another deal yesterday.
Oh.
Okay.
Another client who's with you said, man,
Well,
if
that's
Wade
great.
There, then I'm coming on.
Oh.
Contract.
Well, that's great. That's great. That's great. Makes me feel good then.
Well, right on, right on. In fact, you have a phone call, 713-526-1230. Dr. Wade can do almost anything. What can't you do?
Pertaining to your teeth.
Yes. Well, I meant that.
Okay. I just want to be making perfectly clear.
Okay.
Dr. Wade can do anything.
Oh, okay. That's Al Freeman telling you that she can do anything. And anyway, let's get to the telephone. 713-526-1230 is the number.
Hello.
Hello. This is Dr. Wade. How you doing today?
Hey, Dr. Wade. This is Queen Bee over at the Bartlett Real Estate Group. How are you?
I'm doing just fine, Miss Queen Bee at the Bartlett Real Estate Group. How you doing today?
I'm wonderful. I just want to tell the listeners how great of a dentist you are. You really took great care of myself and my son. Dr. Wade is the one if you want $1 million smile and not pay $1 million for it. She is definitely the doctor to see. She knows what she's doing. She has her chairside manner is awesomely great. Very, very kind and caring. And my son, he's got his braces on. Well, he had them on. She's taking them off now. He has 6 retainers, so I don't have to worry about him losing his retainers and his teeth going back to where they were. So I just wanted to let you know we really appreciate you for taking care of us.
Well, thank you so much for calling in. And would you mind telling the listeners a little bit about your veneers that you're so happy with?
Those are veneers?
Those are veneers.
Oh, I just
They
thought
are.
you just had it like that. You should.
Well, actually, I had veneers that another doctor had done for me probably about 10 years ago, and then I really didn't like them. They didn't do a great job, and I told Dr. Wade that I wasn't happy with them. So she told me to come in, and actually when she took them off my teeth, she put temporaries on, and they looked better than the veneers that I had on originally. So I was happy with the temporaries, and I'm like, oh my God, if my original veneers, as the new ones that she does, looks anywhere, look half as good as the temporary, I'm going to be happy. And they do. I mean, I get compliments on my smile all the time, and I'm confident. I know I have a beautiful smile.
I think both of you ladies get plenty of compliments all the time.
About our teeth, yes, we do.
I was really concerned about, I didn't want my teeth to look too white, to not look natural, and she was really careful about that for me. She was like, no, I said, I don't want to walk around and people know I have veneers on my teeth or anything. I just want them to feel like they're my natural teeth. And you know what? That's how they look. I never, unless I tell someone I have veneers, they just tell me how pretty my smile is, and then, of course, I tell them the reason why.
Well, I'm so happy that you're happy with your new smile, and you just keep smiling. Since I've given you that movie star smile, you can't do anything but.
Now,
That's right. Well,
now, do you tell them why? Because you're drumming up business for Dr. Wade, or do you just want them to know that you've had it done? Why would you do that? I'd let them think, because I thought they were, all yours. I was saying, boy, this woman is blessed.
well, I mean, honestly, there are so many people. I mean, Dr. Wade, she did have to do some things to my teeth to get them here, other than just replacing the veneers I had on. She had to go in and she put braces on my lower teeth, and she had to open my bite. So there were some things she had to do to get me to where I'm at, and I want them to really know, how talented she is, and I want to sing her business, and I want them to know what a great job she did, because there's nothing like a personal testimony, and I'm sure there are others who have some issues, with their bite or their teeth, that, they're not super comfortable with their smile, and I want them to know that she's right here in Houston with us, the best cosmetic dentistry. And actually, I was in the dental field for like 13 years, so I know good dentist and dentistry, and she is one of the top.
Okay, I appreciate that. I really do, Miss B. Bartlett from the Bartlett Real Estate Group.
Thank you, and I appreciate everything from you.
Okay, thank you for calling in.
Okay, bye.
All right, bye-bye.
Thank you for your call. 713-526-1230, 713-526-1230. We were having a little bit of fun. Dr. Karan Wade is in the house. And it was really some fun at some people's expense, I guess, in a way, because we were joking with people who have the gold teeth. Now, I know that in this day and age, some of the rappers, they're still doing the grills
They're
and
still
stuff.
doing the grills.
But for those of us who have the real gold
The real
teeth,
gold one.
sometimes we put champagne
Exactly,
glasses.
and I've seen those. I've had it's usually the generation that's like in their late 50s, early 60s, maybe into their 70s. They come in sometimes, and they'll even have false teeth. They'll have dentures, and they'll have the little champagne glasses on their teeth. They will have had the lab fabricate that particular tooth to look like it's a real tooth, but it has a little champagne glass on it with the gold outline, and some of them want open face crowns and things like that. So there's still a demand for that kind of thing. So, like some of the older generation. I've even had some younger people to come and request those kinds of things. They just want something permanent on the teeth. They don't want to do the grill. They just want to get like one gold tooth or something like that. But I think, so I think that's starting to fade out. Of course, those ones who are into the wrapping and things like that, they still want those grills and things like that. I'm not a big fan of that because they actually destroy your teeth. I have had several patients that have come in and they have had grills in their mouth, and they were the kind that come in and out, and they never took them out. And what happened is their teeth started breaking down up under because they were eating and drinking with it. And so what happens is whatever they were eating and drinking came in up under their teeth, up under the grill, and their teeth started breaking down. Their natural teeth started to break down.
Yeah. Well, we have some calls, but we can talk. We'll pick up on that conversation. Okay. Hello, AG. You're on with Dr. Karan Wade, and AD has made his arrival too. So AD and AG are both here.
Dr. Wade, my aunt has Medicaid. Do you accept Medicaid?
Yes, we do accept some of the Medicaid programs. There are several different Medicaid programs, but what I would recommend is that you call the office. The office number is 713-654-7756, and talk to the staff, and they can tell you exactly which Medicaid program that we take, because Medicaid has probably 6 or 7 different programs, and some of the programs we do take and some of the programs we're not affiliated with. Okay,
can you give me that number one more time?
713-654-7756.
Thank you very much.
Okay, you're welcome. Thank you for calling in.
Now, I must question you about, I thought Medicaid was Medicaid. There are different
types of Medicaid, just like there are different types of insurance plans. So Medicaid has different programs. One could be through Molina, but it's a Medicaid plan. One could be through DentaQuest, but it's a Medicaid plan. One could be through the state of Texas, but it's a Medicaid plan. So there's several different types of Medicaid plans, and some of them we are affiliated with, and we do accept them, and some of them we don't. So that's why they would need to call the office and let them know exactly which plan they're on.
Really?
Yeah.
See, I'm at that age when I need to know. So it won't be just Medicaid.
No, it's not just Medicaid across the board. It's still a state-funded program, but there are different entities that are like the administrators of the program. Exactly. So that's what it is. Yeah.
Okay.
And they have different names, but there's still a Medicaid program. But some of the Medicaid programs don't even have dental coverage, and some of them do. Most of them do, but there are a couple of them out there that don't have dental coverage. So you just need to call our office and find out which plan, let the office know which plan you have, and they'll let you know whether we accept that plan or not, and whether you have dental coverage with that plan or not.
Now, since I don't know jack about this, where would I get the information? Could I call your office and find out?
You can call the office. If you have your card, your Medicaid card, you just call the office.
Well, I don't have it yet, but that's what I mean. So when I'm ready to...
When you obtain your card.
I got 2 more years.
When you obtain your card, you can call the office, and we'll let you know which plan that we accept.
All right. Now, is the one that you accept the best one?
They're all the same. They only pay for specific things, and they don't pay for anything cosmetic. They only pay for like partials, dentures, fillings, extractions, basic dentistry, but they don't pay for cosmetic dental work.
So if they decide I don't need a particular tooth, they will pay for it.
Wait, say that again?
If they decide I don't need a particular tooth, if they say it doesn't, you said cosmetic, and I may want to look good, but they say, well, you don't need that tooth, they won't pay for it?
Well, meaning that it's just say your tooth was discolored, or it was broken a little bit at the edges, and you just wanted to fix them. That's considered cosmetic, and they will not pay for anything.
Oh, okay. I thought you were saying if it's in the back of your mouth.
No.
They can't see them.
No, that is not what I was saying. No, anything that's considered cosmetic, they will not pay for.
Okay.
Right.
Now let's get back to the grills, and we do have phone lines that are open: 713-526-1230, 713-526-1230, and it's not just the grills, but the gold teeth as well. Now, I'd heard for years that they were really not good for your teeth. That stuff can, I guess, get trapped behind them.
Right, because a lot of, like I was saying earlier, a lot of people have those grills, or young adults have those grills in their mouth. And the thing is that they're just something that actually snaps on and off, that they can take in and out. And what's happening is that they're leaving it in their mouth, and they're not taking it out when they're eating, or they're not taking it out and cleaning it after they eat. So what's happening is whatever they eat or drink or whatever is getting trapped between that grill and their tooth, and that food or drink is getting trapped there, and it's just sitting there on the enamel. If you just think about pouring salt on an ice cube, you know how it starts to disintegrate and starts to get little holes in it. The same premise is going to happen to your teeth. So if you have a grill that is removable,
Then remove
you
it.
should take it out when you're eating, or at least after you eat, take it out and rinse it out and clean your natural teeth and put it back in if you're going to wear those things. There are some people who have grills that are actually cemented in, and those are better because you can't, when you're eating or drinking, the food is not going to get trapped in between because it's actually cemented to your natural teeth. So those are better than the ones that come in and out.
Oh, right.
Not that I'm advocating either one of them. I don't like either one of them. But, the lesser of two evils.
But with the price of gold these days, you really have to be flossing in order to be able to floss those.
I guess so.
All right. Hello, Lee. You're on with Dr. Karan Wade. In the mix on KCOH.
Hello?
Hello? Yes. Hello?
Yeah, good afternoon. This is Dr. Wade. How can I help you?
Yes. I had some work done to my teeth. They had chipped in the front.
Okay.
And what the dentist did, he filed my teeth straight across.
Okay.
And therefore, it seems like I got a gap in my mouth. Now, my bottom two teeth, they has also chipped as well.
Mm-hmm.
How would you go about fixing that?
Okay. Well, depending on how much your teeth are chipped, you probably would need a veneer, and that's just kind of like a covering, something like a crown, but it would just cover the front portion of your teeth and drape over to the edges of your teeth to restore that part that was chipped down or that was filed down. So a veneer or a crown would be the best option. But without seeing you, I'm just kind of guessing. So what I would recommend, you come and call the office at 713-654-7756. Give us a call, and you can come in for a free consult, and then I can take a look at you and then let you know exactly what you need to have done.
Great. Thank you.
Okay, you're very welcome. Thank you for calling in.
All right. And others, you are welcome to call 713-526-1230, 713-526-1230. Dr. Wade is a highly competent, well-trained, and experienced dentist. She is also served in her lifetime as a nurse, so she has an excellent bedside manner. And then, of course, she is a very beautiful person inside and out, and so you would have a great experience working there. And then she has fabulous facilities, almost every luxury that one could want as you await your service. I don't know if they have when you're sitting there, it's almost like waiters or waitresses would come out and serve you, but you all haven't gone that far yet.
We haven't gone that far yet. We'll give you a glass of water, bottle of water, but we haven't gone that far. We're not serving breakfast, lunch, or dinner yet. Not yet.
but you do have very nice offices, and all the amenities are around.
We try to stay up with what's current, with our x-rays and the digital x-rays, and, so you won't be exposed to as much radiation, things like that. So I love that part of it. And we also do the intraoral pictures. So when I take pictures of your teeth, we take pictures of the inside of your mouth so you can see what I see. And that's, usually a selling point in and of itself, because I can tell somebody all day that this tooth needs a crown on it. It's broken down. And if they can't really see it, they'll probably just kind of blow it off. But when I take a picture of it and I blow it up on that screen that's sitting there in front of them, they usually tell me I need a crown on that tooth before I even come in there and say anything to them. So, I like to use all the modern technology, all the gadgets that, that are out now, just so the patients have a better sense of actually what's going on. It's not like in the olden days where you went to the dentist and the dentist said you need this, that, and the other thing, and you had no idea whether he or she was telling you the truth or whether you really needed that or even if you wanted it. So now, with the modern technology, I can show patients exactly what's going on in their mouth and let them see, and they don't have to be a dentist to understand what I'm talking about. I can just show them the picture, and as they say, a picture's worth 1,000 words, so works very well.
All right, well, let's get back to the telephone. Hello, Frank. You're on with Dr. Karan Wade.
Yeah, good morning, y'all.
Good morning.
Do y'all fix dentures?
Yes, we make dentures. Yes, sir. We make them and we also repair them.
Yeah, I meant repair.
Okay.
I got a bottom denture that I dropped on the floor and it cracked right in half.
Right.
So basically I got 2 dentures in my bottom.
Right.
And I was wondering, will that deform the 2 pieces just by wearing them like that?
Well, they're not going to actually fit very well. It's going to be kind of difficult for you. You're probably manipulating your jaw around enough so you can keep them in. But I would recommend that you get them repaired, because what's going to happen is going to start making pressure points on your gums, because you might be chewing on one side, and the other side, since it's not a full denture, since it's broke, you might put more pressure on one side of the mouth than the other side of the mouth. So I recommend that you do get that repaired.
Yeah, that is exactly what's happening.
Yes.
I probably go through a tube of glue a week.
Right. So you really need to get that repaired. I mean, basically, you come to the office and we send it to the lab. They'll repair it and get it. Most of the time, they can get it back the same day. If you come early that morning, you can get it back the same day. And if not the same day, you can definitely get it back the very next day. So you won't be out without your dentures for very long.
Can you give out general prices on that?
I don't know any prices, because what we do is based on your insurance, or it's based on the cash fee, and I don't take care of that part of it. But if you call my office at 713-654-7756 and speak to one of the girls who answer the phone, they probably can give you a generalized fee based on your insurance, or if it's a cash price, they'll give you that fee also. Okay.
All right, I'm kind of driving, and I didn't get the number, but I'll be listening, and I'll get it.
Okay. Well, we're located at 2101 Crawford, on the corner of Crawford and Webster, Crawford and Gray, right across the street from St. John's Church.
Crawford and what?
Crawford and Webster, Crawford and Gray.
Oh, okay.
Okay.
All right.
All right. Thank you. Mm-hmm.
All right, thank you, Frank. And we have about 5 minutes or so to go. And if you want to join us, give us a call, 713-526-1230, 713-526-1230.
KCOH Houston,
a better broadcasting company.
the new 1230.
Yes, Dr. Karan Wade. She's the old Dr. Wade.
The old Dr. Wade?
Well, you know what we know. We're the new 1230. You look the same.
I still look the same? Good.
Still look the same. I believe Bill Russell is the person who brought you to the...
He did. Mr. Bill Russell is the one who invited me on his show. It was Car Talk then. I'm not sure what his show is called.
Well, it's still Car Talk.
Car Talk,
But
okay.
he talks about everything.
Yeah, I know.
Yeah.
And so he invited me to come on his show one day, and I came, and here's history.
Here's history.
I'm still here.
All right. Well, someone else wants to talk with you. Let's get back to the telephone.
All
Hello?
right.
Hello?
Hello?
Yes.
You're on with Dr. Wade. She is
You have a
listening.
question?
Yes, ma'am. I have a question. I went to the dentist not too long ago, maybe about 2 months ago,
Okay.
and I was getting all my teeth pulled. I got them all pulled except one. I got except 3, and I wanted to keep those 3. But she pulled them, and my gums just not getting well.
Well, once you get an extraction done, whether you get one tooth or multiple teeth, it takes 6 to 8 weeks for your teeth for the tissue to totally heal. Now, if you have some underlying health problems like diabetes or something like that, it might take you a little bit longer. So there are a lot of reasons why your gums don't heal as quickly as they should. So if it's been within the 6 to 8 weeks, you're still within the healing time.
Yeah. Well, I got dental insurance. It's been about 3 months now.
Mm-hmm. Do you have any underlying health problems?
No, I don't have no underlying health problem.
Okay. Are your gums infected or anything like that?
No, I got the 3 teeth. I got 4 teeth left. One.
I have a question for you. Sorry. How do you know your gums aren't infected?
Because I go to the doctor most of the time.
To your medical doctor?
I don't have no bottom teeth at all.
Okay, well, if you have those teeth are left in the top that you still have left?
Yes, ma'am.
Okay, well, you're probably traumatizing your gums because you have teeth at the top and no teeth at the bottom. So every time you're trying to chew or eat something, those top teeth are hitting the bottom gums, and that's why they're probably having some pain down there because you're traumatizing your bottom teeth, your bottom gums, rather.
Well, I want to set me an appointment. I'll call you back and set me an appointment with you.
Okay.
I got dental insurance.
Okay, so give the office a call and we'll get you taken care of, okay?
Okay, what's the number?
713-654-7756.
7756.
Yes,
okay,
sir.
And my name is Benny Sampson.
Okay, thank you, Mr. Sampson. I appreciate you calling in.
Okay.
All right, bye-bye.
Bye-bye. Yeah, I was curious because many times we have infections and don't know it. We have infections.
A lot of people have periodontal disease, that's a gum disease, and they're walking around, they don't even know because they've never been to the dentist or haven't been to the dentist in a while. So it's very difficult to diagnose yourself. And even if you go to your medical doctor, 9 times out of 10, when he asks you to open your mouth, he's not looking at your teeth. He's looking at your throat to see if you have a throat infection. He's not examining your teeth or your gums. So even if you go on to your medical doctor, you could still have an infection in your gums.
You know, your teeth can have impact on your overall health.
Absolutely. There's direct correlation between your physical health and your oral health. Patients that have diabetes, I have had patients that come to my office and they were having problems with healing, and come to find out these patients had diabetes. I said, well, you need to go back and see your medical doctor because it's been a long time and your gums should have healed by now. And patients, as you know, who are diabetics, they have a hard time healing, or it takes them longer to heal. So there is a direct correlation between your physical health and your dental health. You can have a stroke if you have periodontal disease, and that same bacteria that's in your mouth gets into your bloodstream, can travel through your bloodstream and go to your heart. It can go to your brain and other vital organs. And so, like I said, there is a direct correlation between your physical health and your oral health. So you should see your dentist at least twice a year.
And, of course, if they want to see you,
they can give us a call at 713-654-7756, 713-654-7756. The office is located at 2101 Crawford on the corner of Crawford and Webster, Crawford and Gray.
And can I expect to be able to see you within a reasonable period of time?
You will be able to see me. We usually get our patients in within a week of them calling, and most of the time, sometimes we can get patients even in on the same day. If they don't mind waiting, we'll work them in.
And you work some weekends?
We work on Saturday. We work the first and second Saturday of every month. So if you can't come during the week because of your work schedule or just, whatever reason, we're there on Saturdays from 8 until 12 on the first Saturday, and then from 8 until 3 o'clock on the second Saturday.
All right. Anything else?
That's it.